Bronchiolitis is an illness caused by inflammation in the small airways in the lungs. They're called bronchioles. And that makes it hard for air to get into the lungs, so there's trouble breathing. Actually, many parents haven't heard of bronchiolitis, but it is common in babies, especially from 3 to 6 months old. And if your babies are premature, they're even more likely to get it. That's because the lungs and the immune system of a preterm baby just haven't had time to develop fully before the birth. The condition's more common in the winter months, November to March, and the cause is usually a virus called RSV. Now that's short for respiratory syncytial virus. But actually other viruses can lead to bronchiolitis as well, like adenovirus and rhinovirus, which is linked with a cold. RSV is very, very common, and almost every child is exposed to it and catches it before their second birthday. Some of them only get cold symptoms, but for many of them, they get bronchiolitis, which is much more than just a cold. There's a big difference between bronchiolitis and bronchitis. Bronchitis is a condition that anyone, adult or child, can get. It's linked with infection in the larger airways of the lungs. But bronchiolitis is infection in the tiny airways, so the symptoms are different. A baby with bronchiolitis can have cold symptoms to begin with, like a blocked nose or runny nose. Sometimes there's a cough, a bit of a fever as well. Now, over the next few days, symptoms can worsen and change. A rasping cough is the most obvious development, but there are several important symptoms to look out for. Fast breathing, often shallow, quick breaths. Appetite loss or inability to feed properly. A cough, that distinctive rasping cough. A temperature, and it's often quite high, more than you'd expect with a simple cold. Remember, FACT, F-A-C-T. If one of your babies has these symptoms, get advice from your doctor. You can't always prevent bronchiolitis because the virus spreads easily through the air from person to person. But you can help by washing your hands regularly with soap and water, especially before touching your babies. And of course, make sure everyone who handles them also does the same thing. Keep your babies away from adults and children who are ill or have cold symptoms. Also, wash and wipe surfaces around the home regularly to stop germs spreading. And by the way, this includes your children's toys. Make sure you keep your baby away from tobacco smoke. That's really important. In some cases, babies with a high risk of developing severe bronchiolitis are offered monthly antibody injections to help protect against RSV. Your child's pediatrician or neonatologist will give you more information and advice on this if your baby's at high risk. When to get medical advice? Well, watch your babies when they're unwell and contact your doctor if things get worse. Use your instincts and obviously don't delay. Most babies with bronchiolitis can be treated at home, but always get your doctor involved. Get medical help urgently or call for an ambulance if your baby struggles to breathe or turns blue. Babies who have other problems like a congenital heart condition are more likely to need hospital treatment, and in fact overall about 3% of children with bronchiolitis need to be in hospital. And there they're usually treated with oxygen, a nebulizer and with fluids.